My name is Ken O'Neill. I am the head of a new department, the Department of Clinical Genomics. I'm also the head of a new center, the Center for Precision Oncology and Cancer Prevention here at Roswell Park Comprehensive Cancer Center. We have in each of our cells roughly 22,000 genes. Of those 22,000 genes, only a very small subset, somewhere between 40 and 100 genes, actually function to protect us from developing cancer. So when we think about genetic testing, what we do is we actually look only at that subset of between 40 and 100 genes. We sequence them, and when we look at the sequence, we're looking specifically for some change or variant in that sequence that turns off one of those 40 to 100 genes. And you can imagine that if you turn off a gene that acts to protect us against developing cancer, then our risk of developing cancer is higher. There are several reasons that a person should have a genetic evaluation. First, for a patient who has already been diagnosed with cancer, for common cancers such as breast cancer, ovarian cancer, prostate cancer, pancreatic cancer, endometrial cancer, and colorectal cancer, knowing this information can help doctors determine how best to treat them. So it matters for patients who are already diagnosed with cancer. But at the same time, knowing this information is important for future risk for cancer. For people who have not yet been touched by cancer personally, it can help them know their risk. It can help them and their doctors take action to prevent that risk. Knowledge is power. Of course, it also matters for their family members because genetics is about inheritance. Genetics is a family affair. And so for a person who may be at high risk for cancer, their children may also be at high risk, and that risk may be as high as 50%. If you know what you're facing, then there are definitively medical interventions, both surgical and non-surgical, just surveillance imaging, things that we can do to keep people safe. Knowing the information about an individual's genetic risk for cancer can certainly play a role in a person or a family's decision to have children and the timing of having children. So for example, we don't have right now very good screening tools to identify ovarian cancer. Our recommendation is that a woman who's predisposed to ovarian cancer would have her ovaries removed, depending upon the condition, somewhere between ages 35 and 50. If that's the case, then it may be important for a woman who chooses to have children to think about having children before the age of 35. And so certainly this information matters not just for the woman, but for how she plans her family. The Clinical Genomics Department at Roswell Park is, I'm happy to say, unique in the world. There isn't a program like it that exists anywhere that cares for all people and all families. And that's what we have here at Roswell. In my 20 plus years of doing this, what every single patient I've ever come across has said to me is that getting diagnosed was the easy part. Figuring out how to manage things after that has been what's really hard. So what we do for the patients is we take that off their plate, and we help them coordinate their care, and make sure that all of their providers, all of their cancer prevention care happens when it's supposed to, and that everyone who is part of their personalized care team is in the loop about everything that's happening to the patient and all the other components of wellness that we're bringing to them.